it's actually, the fever is the natural reaction of the body to try to fight against certain organisms. As you know, I mean, if you want to kill the bacteria from water, you should boil it. Well, in a certain way, that's what the body tries to do, increasing the body temperature to kill the bacteria or parasites that you might have. It's very effective. So in a certain way, we shouldn't try to stop fever, but we do because patients feel like body ache or they don't feel well, and the cause of that is the fever, the whole immunological reaction to the fever. But you could perfectly live with 104, 101 actually, with not that much of a problems. But if you want to do something, well, you should try use warm water towels in your forehead and your neck, because there are main blood vessels going through your neck, so that will help you cool down a little bit. Do not cover yourself, because that is something a lot of people do. They have fever and they just go in bed, they put like tons of clothing and the bedspread and blankets. So of course, if you do that, your fever is only going to get worse. So try to be on your regular pajamas or like regular clothing, and probably your temperature will be controlled that way. Always check your temperature. If you can do it like every hour or two, to see if you have different variations of the temperature, or certain fevers only spike once in a night or once every 3 nights. So that will be helpful in case you need medical attention, or at least some people think they still have fever when the fever went, I mean, 2 hours ago they went off. So you should monitor your temperature all the time. And of course, yeah, you should try to take certain medications. Acetaminophen, it's a good medication for fever. Or if you have something else, maybe ibuprofen or naproxen, even aspirin. But now, not many doctors recommend aspirin for fever, especially in young patients, because they might have a risk of developing Ray's syndrome, which which is a complication in the liver, but it's very uncommon, and it's more associated with fever caused by the chicken pox. So, well, probably you should stick to acetaminophen or ibuprofen. And I said it last time, but I will repeat it. Try not to use antibiotics, even if you had them from a previous infection that you had, urinary or skin infection or respiratory infection. Maybe you have some antibiotics that were left, and you say, well, I had the fever last time and doctor prescribed this, then why shouldn't I take it? Well, you have to know that right now bacterial resistance is a big deal, and probably we are running out of usable antibiotics for certain infections. So by doing that, probably you're contributing to that, and might be more difficult in the future to do it. Most fevers are caused by viruses, not bacteria, so antibiotics won't work. So try not to do it, or at least that's my advice.